What is the real cost of breast augmentation? So the cost of breast augmentation really kind of depends. It's region-based, but more importantly, you're going to find a range of breast augmentation in kind of the region of the United States you're in. It can range anywhere between $4,000, up to $12,000, and there's so many different factors that play into the cost of this procedure. Now let's talk about what are the big kind of points or factors included in a breast augmentation. The first one is the surgeon, and it's called the surgeon's fee. And it depends on the surgeon's experience, I guess the quality of the surgeon, whether they're board certified, how experienced they are, how long they've been doing it. And so that can kind of be a variable that's going to get very dramatically. The next factor is called the anesthesia. And typically that's to be a separate line item. And anesthesia, it can be from sedation to actually full anesthesia. And the big point of this is there's a lot of variability in the cost of anesthesia. It can be as simple as conscious sedation, where you get a little IV medication, maybe an IV, to get you sleepy enough to where you can have that kind of a surgery. That's directed by the surgeon himself, who directs a nurse or some kind of clinical assistant to do the anesthesia. And that's a very, very inexpensive way to do it. Safety-wise, you need to be asking those kind of questions if the surgeon is qualified to be doing that kind of sedation. It can go up to full anesthesia, where you have an anesthesiologist, which is also a medical degree, and this is what they do. They're board certified anesthesiologists, and they provide anesthesia for all kinds of surgery, not just breast augmentation, but a variety of different types of cosmetic procedures. And so that's typically the high end of anesthesia. And the cost of the anesthesia depends on how long it takes. Typically, it's going to be a range between maybe 30 minutes to an hour. I've heard of patients having breast augmentation for 3 hours, which, if the surgeon is slow or the facility, there's something going on, it could take a long time. But typically a breast augmentation is going to last somewhere between maybe a little bit less than an hour to up to 2 hours on average. If you're taking longer than 2 hours for a breast augmentation, then you need to ask some questions. The third thing is called a facility fee. And the facility fee depends on the area or the place you're going to have the surgery itself. Or you need to ask your surgeon, am I going to have a surgery in the back of your office in a closet? Or is there a private surgery center in the back of your office? Or is it a surgery center, like a standalone surgery center? This is all they do is maybe these procedures? Or is it associated to a hospital? Where you have your surgery is very, very, very important, because what comes into play is like what is available for the cost of supplies and the personnel who are going to be doing the procedure. I can't emphasize enough, people, this is real surgery. This is, things can happen during the procedure, and you want to make sure you have the right staff and the facilities that can accommodate any kind of emergencies. That's the big point. So if you have a procedure in the back of someone's office and there's only one medical assistant and the doctor, and something goes wrong, who's there to help? Do you have the supplies to help? Can emergency kind of response be quick enough to kind of get you into something and get you safe? Versus like in your hospital setting, you have a whole team of medical personnel. You have nurses, you have anesthesiologists running around. You have all this supplies and equipment in case there's an emergency. And you're also in the hospital itself. And that's kind of like between the two ranges of really kind of unsafe to very, 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 very safe in case something happens. But the cost of the facility depends, it does come into supplies, right? Like what kind of equipment is used? What kind of, supplies are used? Where are you getting the implants from? Are the implants being handled correctly? Whether the sterile technique is consistent? Are the instruments being properly processed, which is called a sterilization process? Is that happening? So all these kind of factors come into play when it comes to the facility fee and for supplies. And I can't emphasize that enough, that you need to ask these questions of where's my surgery going to be done? What's the facility? Who's going to be doing the anesthesia? And then how are you board certified? If you're a plastic surgeon, you want the surgery, I would recommend you're a board certified plastic surgeon. And how many have you done, and how often do you do them? And these are all big points when considering this type of procedure. So I hope you enjoyed this video of what it costs for breast augmentation, why it costs this much, and what you should expect, and what kind of questions you should ask when you're considering the procedure. Don't forget, please subscribe. Thanks for watching.